healthcare, environment, education, and many more. Each webinar is an interactive session with a deeper understanding of the topic at hand. If you miss any part of the session or would like to go through the previous sessions, kindly visit our website, vishwa.org, or Vishwa Talks YouTube channel for a full library of past Vishwa Talks on various interesting topics. Imagine dedicating your life to answering one simple yet profound question. How can we help people live healthier, happier, and longer lives? Our speaker today has spent more than 2 decades pursuing that very mission. While many see Ayurveda as an ancient tradition and modern medicine as the future, she has worked to bridge both worlds, combining timeless Ayurvedic wisdom with scientific research and evidence based healthcare. Throughout her journey, she has led large scale healthcare and clinical research initiatives, guided multidisciplinary teams, contributed to the development of Ayurvedic medicines and wellness products, and upheld the highest international standards of quality and patient care. Yet, at the heart of all these achievements lies a simple belief: true healthcare is not just about treating disease, it is about preventing it and empowering people to take charge of their own well being. Today, she continues to inspire countless individuals and communities by promoting preventive healthcare, demonstrating how Ayurveda can become a practical guide for lifelong wellness. Please join me in giving a very warm welcome to Dr. Shrujana Komat Reddy, an experienced Ayurveda practitioner and healthcare leader on Vishwa Talks, to share her insights on building resilience naturally, Ayurveda for gut health and immunity. Very good morning, ma'am.
Good morning, Trishant. Namaste, everybody. Thanks for joining. And thank you for the nice introduction, Trishant. So, shall I start sharing my screen?
Sure, ma'am.
Yeah, okay. Okay, I hope everyone is able to see.
Just a moment.
And another thing, am I audible?
Yes, ma'am. And the
Thank
screen
you.
is visible too.
Thank you. Namaste, everyone, again. So, as Trishant mentioned, I'm an Ayurveda Vaidya and managing partner of Sri Jayanti Wellbeing. So here I am to speak about Ayurveda, which is very close to my heart. That's where I belong, and that's my roots. So, having treated or practiced Ayurveda for over 20 years, there are very common problems that we see in the society that people face. So we all look very healthy, we all look very active and all of that. But when people come and speak to us, there are a lot of things that, people suffer from. So that's why I thought building resilience naturally, how do we do that? And how Ayurveda can help us. That's the topic for today. So before we get into the session, so we'll do some self-reflection. So quickly, what are a few issues that you face? You all must be from different backgrounds, right? So in the next half minute, can you let me know what is the expectation out of this session? Just one or two people, please. Anybody? No? Okay, then let me see. When do you all wake up? You don't have to answer right away, but just ask yourselves. And also, do you wake up feeling refreshed or do you feel tired at the end of, when once you wake up in the morning? And how often do you feel tired, sick, and low on energy when you wake up in the morning? So, do you feel stressed and mentally drained frequently? That's what we observe. On a day-to-day basis, most people complain. At the end of the day, they say they are feeling stressed and mentally drained. Why is that happening? And do you know what is a connection between digestive health and overall well-being? So let us see what Ayurveda has to say about this one. So I'm sure you all must be knowing what Ayurveda is. It is a science of life, and here you see a picture that there's an operation going on there, right? So Ayurveda is you can date that back to 5,000 years ago, and it is one of the treasure and knowledge base that Bharat has to offer to the world. So we should be proud of what we have, and all the health solutions, they come from Ayurveda. So Lord Dhanvantari is the god of medicine, as you all know. So we can just call Ayurveda Amrutanam. It is the elixir that the seers have given to us to practice daily and also as a treatment methodology. So surgeries dated back to those, centuries ago and then thousands of years ago. So you all must be knowing Sushruta. Have you heard of Sushruta? He's a father of surgery. So they have done rhinoplasty, cataract operations, and the treatises mention about shastras and the yantras that have been used way back. Even autopsies were done at that point in time, and from there to giving health solutions to treating people with minerals and metals and everything. So all of these are there in the treatises like Charaka Samhita, Sushruta Samhita. There are several treatises that we have where this knowledge is present and we can use that knowledge, right? So let us see what Ayurvedic definition of Ayurveda is. So it is samadosha samagnischa samadhatu malakriyaha prasannatmendriyamana swastha ityapidiyate. So I mentioned this, and I would want all of you to please follow this because there is a reason why I mentioned this. This definition conforms to the definition of health given by World Health Organization. Now, what is Samadosha Samagnischa? So there are three doshas. Have you all heard about Vata, Pitta, and Kapha? I'm sure you must have all heard, at least from your grannies, Vata Mikwa in the, if all of you understand Telugu, right? So Vata dosha, Pitta dosha, and Kapha dosha. Samagnischa. So Agni, there is Agni is a digestive fire. And Samadhatu. Samadhatu is, there are Sapta Dhatus um, and in the human body that are Rasa Rakta Mamsa Medo Asti Majja and Shukra. So, and there are three malas, right? Svedamu and sweat, urine, and stools, right? So, prasannatmendriya manasvastha itya bidiyate. Not just the physical health, but the health of your mental health and the social well being. So, all of this constitute health. That's exactly the definition given by WHO. And we have this definition from Ayurveda. So now you can imagine how scientific and deep the science is and how important it is for us to maintain the equilibrium of all of these physical, mental, and the social health, right? Now, what is the Ayurveda Sutram? So it is Svastasya Swasthya Rakshanam Adurasya Vikara Prashamanam. As I mentioned, Ayurveda is a science of life. It is not just medicine. It is what we need to follow on a day-to-day basis. So Swastasya Swasthya Rakshanam is nothing but you're maintaining and promoting from perfect health, meaning we are maintaining the health of the healthy people. So not just a patient walk into our clinics, it is the healthy people also who take help from Ayurveda, right? And Adurasya Vikara Prashamanam, that is cure and eradicate the intractable diseases. Now, what are intractable diseases? Have you heard about non-communicable diseases, right? What are non-communicable diseases? So we are having the list growing. So earlier we used to have this arthritis, musculoskeletal issues, diabetes, all of these are non-communicable. Now even the cancer cases are rising. There is a reason why all of this is happening, right? So earlier we had some other issues in the past. But as there is advancement in medical technology and with this fast-paced life, so we are having newer issues and which can be avoided. So what are they? Let us just go through. So now, looking at what Ayurveda has to offer, we have branches in allopathic medicine and other medicines. We have Ashtanga Ayurveda, which is 8 branches are there in Ayurveda. That is Kalabala, Kayabala, Grahordvanga, Shalya, Danshra, Jara, Vrushan, which is now we have general medicine and we have Bala is pediatrics and Graha Chikitsa is psychiatry and Urdhva Jatrugata Rogas, everything above the throat. So all of that come under Shalakya, which is ENT encephalic disorders. Then we have Shalya. Shalya is surgery. So father of surgery is Sushruta. So we have those techniques right from ages back. And we have Visha Chikitsa, that is toxicology. You can relate that to the forensic medicine. And Rasayana Chikitsa and Vajikaranam. So Rasayanam is what is Rasayana Chikitsa? It is rejuvenation therapy. So which means Rasayanam so these are there are certain medicines that we will need to use on a daily basis. The good thing is that we have most of them in our kitchens, so we've been using them knowingly, unknowingly. However, for each disease, so the topic is dealt with in detail, that there are several drugs, meaning we call all the ingredients as drugs, like you might have heard of amla, haritaki, vibhitaki, and all of those. Though all of those we call them as drugs or the medicinal herbs, shrubs, and plants. So all of these in different combinations, not just these, there are several of them. Lakhs of formulae are there in Ayurveda. From single drugs to complex formulations are being used, and there are different types of therapies like Panchakarma and all of those, which are used as rasayana as well. So there is Naimitika. In this, there are several classifications, and there is these can be used as adjunct therapies, and on a daily basis, we all consume amla on a daily basis. Without our knowledge, that's a very rich source of vitamin C and antioxidants, right? So that is one branch. And then Vajikarana is aphrodisiac treatment, that is for the healthy progeny. So all these Arogya Sutras are mentioned in Ayurveda in detail, and every shloka, I would say, is worth researching on. So that is a treasure of knowledge that we have. Now, so in the beginning, I would have told what is Tridosha cycle. So that is Vata, Pitta, and Kapha. So these are the pillars on which the human body functions, right? So Vata, Pitta, and Kapha. So once we say Paityam Ekvaindi, so this, or there is Vatam Ekvaindi. So all of these we hear on a daily basis. I was mentioning that in Telugu, but these terms are often used, Kapha, Vata, and Pitta. But then, so each individual is different, and that's why one treatment doesn't work for all. Suppose there's a surgery. So, not every patient who undergoes surgery will respond in the same way. Wound doesn't heal in the same way, right? Some may have keloids, and then some may heal faster, some heal later, and there'll be scars and all of those. So, why does that happen? So, because we are all unique and our constitution is unique. That's Prakriti is unique. So Tridosha. So we have several permutations and combinations, right from higher level of classification, right? Everything above the throat is Kapha, and the middle part of the human body, we can relate that to Pitta, and anything under the navel is all Vata. So that's a very broader classification. We have several classifications like that, and these tritoshas are present at cellular level also, and the metabolism is defined by all of these factors. Now, what are the qualities of Tritoshas? So, Vata is mainly meant for movement, creativity, lightness. So, so the beauty of the science is that when we look at the patient walking in and looking at the stature, looking at their behavior, looking at the the way they present themselves, and then looking at all the suffering that they have, we will be able to gauge whether what kind of prakriti they have, and then what is the issue that they are going through, especially with nadi pariksha. Nadi pariksha is followed by most all the ayurvedic doctors, and that is very very important to assess the constitution of a person. Now, what is pitta? It is fire, heat, transformation, and strength. Kapha is there's a lot of steadiness, heaviness, calm, grounding. So these are all the qualities. So how each person will have either vata prakriti or pitta or kapha, or in combinations. So that is how a human body is made. Now, why we mention this? There's a relevance to this tridosha cycle. That's a circadian rhythm, right? So you all must be knowing that there's a Nobel Prize awarded for circadian cycle a couple of years ago. Now, what this was mentioned in Ayurveda way back. Now, if you look at the timings of Vata, Pitta, Kapha, so during the day and during the night, there is predominance of each of the doshas. So now, if you take morning 6 a.m. to 10 a.m., Kapha is predominant, and 10 a.m. to 2 p.m., Pitta is predominant, and 2 p.m. to 6 p.m., again it is Vata time. Not that the other doshas won't be there, but these are the timings where these doshas are predominant and significant. Now, in the night also, in the evenings, then again it is 6 p.m. to 10 p.m., it is Kapha time, and 10 p.m. to 2 a.m., it is Pitta, and 2 a.m. to 6 a.m. again it is Vata. Now, we'll just look at when do we have to wake up now. So, according to Ayurveda, we should be waking up before the sunrise, 1 to 1.5 hours before the sunrise. That is Brahma Muhurtam. So, which is around this time, right? Because during that time, all the three doshas are in equilibrium, and hence any work that is being done, that is an ideal time for meditation, that's an ideal time for exercise, yoga, and all of that stuff. And even in case of kids, it is a very ideal time for their studies as well. So because there is a lot of mental clarity and this clarity of thought, and that's the reason why one has to wake up during the Brahma Muhurtam, which is 1 to 1.5 hours before the sunrise, right? And there's a reason why we call and have breakfast by 8:30. So 1.5 hours after you wake up, we should be having. And what is a morning routine that we need to follow? We'll look at that at a later time. And that's the reason why we mentioned that lunch has to be finished ideally by 12:30 1 p.m., because that's the time when pitta is peaks and the digestive fire is in peaks, and that's the ideal time for digestion. So there any kind of deviations within all of these things, there is obviously that will lead to vitiation of these doshas, finally impacting health. It may not occur in a day or two, but the consistent practice of deviation from these timings and all of that from the daily routine prescribed by the Shastras, that's where we are seeing most of these disorders coming up. Now, what is gut health and immunity per Ayurveda? So we see Agni. So gut health is nothing but from Amashaya and Pakvashaya. Pakvashaya is called the gut, and then the entire digestive health. It starts from mouth until the anus is all GI tract. Entire health is important, and digestive fire, especially seated in the amashaya, that is a stomach, that is very very important. This is nothing but you can relate that to the digestive juices that come in and all of that, right? So that is a foundation for efficient metabolism, optimal tissue nourishment, and the balanced immunity, and which is called ojas in Ayurveda, and ultimately leading to overall health. Now, what is Agni? Agni, as I mentioned, it is digestive fire, and is it just seated only in the stomach? No, there are different types of Agni. That is, Jataragni is in the digestive tract, and there is Bhutvagni and Dhattvagni. Bhutagni is nothing but it is, see, whatever we consume. So you all know Panchamahabhutas, right? So Panchamahabhutas, everything. So the five elements in nature, so all of the food that we consume and the vihara that we do, that is aligned with whatever is there within the human body. So the bhutagni has to be proper for the nourishment to happen to the entire body. And dhatvagni. So what are dhatus? There are sapta dhatus, meaning seven. Rasa rakta mamsa medho asti majja and then shukra. So these dhatus needs to be nourished. So if you take lymphatic tissue, like that needs nourishment. Uh, rasa dhatu. So once the food is being digested, so it is absorbed through the intestines. You all know that, right? So once it is being absorbed, it is to be nourished to all the entire body. So how does that happen? According to Ayurveda, there is the Uttara Dhatu Poshana happens. So it all depends on what food we intake taken, and how we digest that food. So that's where everything depends. So that's how we are what we eat, right? Our health reflects as per what we eat. We eat junk, we will have those kind of issues. We eat healthy, we eat fruits, we eat, as we say, vegetables build the body, and then fruits cleanse the body. So these are all some common sayings, and there is a lot of meaning to it. So how this dhatus are being nourished depends on what we take into our body. So once the rasa dhatu is nourished, then comes the rakta dhatu. So there is sarabhagam and kittabhagam. Those are all technicalities in Ayurveda. So once this rasa dhatu poshana happens, next the rakta dhatu poshana happens. So that is how we diagnose and treat the patients. So when rogi roga pariksha happens, that's how we assess the person. Now, so Jataragni is responsible for digesting food, absorbing nutrients, and transforming them into energy. So it governs both Bhutagni and Dhattvagni. So it is very important for us to have a Samagni, that is Jataragni. And then balanced Agni prevents ama toxins and leads to improvement in the ojas. So the samagni is very, very important for us to prevent ama. Now, what is ama? Ama is nothing but anything in the transforming phase. Like when you boil the rice, so we won't have the half boiled rice, isn't it? So it is going through some process, it is going through some transformation. So once there is imbalance in Agni, so what will happen? Let us see. Ama is formed when there is impairment in Agni, which will impair the digestion and the tissue nourishment, and ultimately it impacts overall immunity in the human body. So now there are four types of Agni. Like, we can call not the types, it is when the Agni is weak, we call it Mandagni. What does that lead to? When your digestive fire is not proper, it leads to poor digestion. There is heaviness and lethargy. Then there is abdominal distension leading to constipation, and there's formation of ama. So if you take all the autoimmune issues, that is just because presence of toxins or the ama in the body. So how does that happen? Again, it all boils down to how you digest the food and what you eat. So it is imperative for us to understand what we eat and how we maintain our health. When there is hyperactive Agni, so it leads to excessive hunger and thirst, leading again, to a lot of issues. Again, there is sore belching. So you might have heard about hyperacidity, and people have a lot of burps and belching. This is quite common in the middle age. Once we hit 30s and 40s, nowadays children in 20s, young professionals are also facing this issue. So why does this happen? There is hyperactive acne there. So why does this happen? There are a lot of reasons behind. So there's some burning sensation in the chest and the throat region when you eat what is not to be eaten, or when your agni is hyperactive. And sometimes there are loose stools and weakness, there is emaciation. All of this happens when the agni is hyperactive. There are some of the common symptoms, not just these are only a few of them, but there are several others, right? So irregular agni, which is again, Vishamagni is what we call. There is irregular digestion. On a particular day, it happens well, and on the other day, it again gets impacted. There is abdominal colicky pain, and sometimes people suffer constipation, and sometimes there are loose motions, irritable bowel syndrome, and then there is bloating and flatulence. So irregular bowel habits develop when there is Vishamagni. So Samagni is considered the ideal state, meaning the Agni has to be proper, characterized by proper digestion, timely appetite, normal bowel movements, good energy, and optimal tissue nourishment. So, how do we maintain and restore gut health? So, for this, Patya have to be followed. So, there's a common notion among people that, if we have to consume Ayurvedic medicines, we have to do a lot of Patya. So, Patya is, let us understand these two words. That is very, very important. I would request that, just understand these words, and then next time when you need this Ayurvedic this thing, don't be lot. There's a lot of I would say fear among public, that there's a lot of heat that develops in the body if I take Ayurvedic products and all of that. So those are some of the products that you find in the kitchen as well. So anything maricha, like black pepper, when it is consumed in a lot of quantities, obviously it is going to create some burning sensation more than the limit, right? So how we cook, how we eat, what we eat also matters a lot. So patya is nothing but do's, and apatya is nothing but don'ts. What you have to do and what you should not be doing. This is a very common understanding of patya and apatya. So, as we all know, there is a reason for a disease to occur, right? There is a cause. There are factors that cause a disease. So, fighting the disease, nidana parivarjanam, fighting the causes, or what do? You have to first fight the cause. So that is why we need to follow these patya and apatya. So what are these? Let us just see how to restore gut health. So let us introspect if we are all having freshly prepared warm meals every day. So we need to have freshly prepared warm meals, and always cooked food and easily digestible food is always better for the gut. Is it possible? We have to make it possible. There's no choice if we have to maintain health. And regular meal timings, and eat only after your previous meal is digested. So, on a particular day, one can experience some kind of indigestion or heaviness in the body, or there are most often we see this in kids, and even for that matter in adults also, especially while we are working, we keep munching, we keep junk, we keep having all the junk and snacking in between meals, right? So we have to ensure that once the meal is digested and once you are hungry, only then you can have a meal, right? And adequate hydration is very, very important. And always, this is a suggestion to have local produce, seasonal fruits, and vegetables. So there's a reason why we should be having seasonal fruits and vegetables. So they grow in that so every the food that is there, we all have different food habits, right? We as a country, we all are from different regions, and we have different eating habits. And then what are the food what is the food that we consume? It is different in different parts of the country, and of course in different parts of the world. Geographically also, there are several eating habits, which is suitable for them in that particular area. So always have a local produce, because that is suitable for us. Not just within the body, it is the environment also that plays a major role. So if you observe, lot of people experience acidity in Varsha Ritu. Once the rain starts, then Udgaram, that the sore belching and all of that increases. Why does that happen? Because in the environment, the amlatvam, or the it is very sour in the environment. That's why, even take a small, you observe this one. You can see how tomatoes taste in when there are rains versus tomatoes in summer. So tomatoes grown in the during rainy season are more sour than what they are, uh, 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 you know, when they are cultivated in the other seasons. Right? So I'm not talking about adulterated food and all of that, but this is the original organic tomatoes and all of that, right? It applies to all other vegetables and fruits as well. So naturally, the amlatvam is more. So we feel those kind of symptoms. So also, if you observe, for every festival that we celebrate, there are different types of food that we take. So if you see Chaitra Masam, there is Ugadi. The most of few states, they celebrate Ugadi, which is a new year, wherein we consume pachadi, or which has shatruchulu, meaning all the 6 days have to be consumed. So in that we use neem flowers. Why are we using neem flowers? There's a scientific reason for it. And it is always good to consume the neem flowers during the entire Chaitra Masam, because there is seasonal variation happening from spring to summer, and then any temperature variations will have an impact on skin. And neem flower is very good for to maintain the skin health. So this is a simple tip, right? So these kind of lot of scientific reason is there for us to celebrate and have particular fruits and vegetables in that season. So even during the Ganesha festival, we eat a particular type of tummikura is what we eat. So that is anti-infectious. It has antimicrobial properties and all of those. So when there are seasonal changes, so we need to follow that ritucharya to maintain health. Again, mindful eating, adequate sleep, and stress management. So these are some of the things that we will have to definitely follow without a choice. It's not a choice, it is mandatory for us to follow. And vyayama in limits has to be done. Walking, yoga, and exercise can be done in the mornings and after a meal. It is always good to have do a few steps. That is because in there's an old saying in Sanskrit, bhojanam katva shatapadam. So at least 100 steps have to be done after meal, is what has been mentioned way back. So these are some of the things that we will need to follow to maintain good gut health. And what hampers gut health? So if you see stale and processed food, so over a period of time, this will lead to a lot of health issues. Overeating and eating before the previous meal digests. And so it is good to do lankanam as well. Lankanam meaning you fast, but regular fasting uh, without following any limits, that again might lead to impairment in Agni. And then heavy and hard foods to digest, if that is being consumed, Rukshahara, if we consume, for example, bread on a regular basis, that is very hard. It is very hard food to digest. So that can hamper health. So, food excessively sour, salty, spicy, and oily. Excess salt can have a lot of issues, not just, there's a lot of fluid retention, and then, we already have a lot of hair fall that people experience owing to several factors like even pollution and stress and all of those things. Added to that, if we see a lot of people having more of salty food. So processed food already has a lot of the snacks that we have, which is bought from outside. They have excessive salt for as a preservative. So that when we consume, it is only going to hamper our health. So this is one of the tips that we can follow, where you should have less amount of salt, to prevent any hair fall as well. Excess sour stuff, it'll lead to hyperacidity. Spicy food, when consumed, again, it's going to hamper your digestive health. Sedentary lifestyle, improper sleep pattern, and chronic stress. So, needless to say, so, every one of us, we have long working hours, we sit for a long time, especially people who sit with who work with laptops and computer systems. You need to sit and then work for a long time. So often we see these bloating issues and all of those. So just be careful that you get up once in half an hour or 20 minutes and then do some walk and all of that. And otherwise, it's only going to impair gut health. So how do we maintain overall health? So preventive and curative approach in Ayurveda. So once we have some complaint, is it just that we need to take medicine only? So Ayurveda prescribes first ahara, then vihara, then comes aushadha. So what we take along with medication, what is the ahara that we consume and what is the vihara? Vihara is not vacation, it is a lifestyle that we follow. So that also comes under vihara. So, dinacharya, daily regimen. So, as I earlier mentioned, we need to uh, make sure we wake up early in the morning. There are certain exceptions where, when a person is sick or when infants can sleep. And then, smaller kids, young kids, aged below 5 years, they can sleep until 6:30. That's fine. But elders have to wake up during the Brahma Muhurtam or before the sunrise. That is always good. And definitely, people who work in the corporate field, if they have to do different shifts, there is no choice but for you to attend those shifts. However, I would suggest that make sure you follow the biological clock, otherwise gets impacted. So make sure you don't do it for a longer periods at a stretch, if that is not avoidable. So that's the first thing. And then once we wake up, we need to have lukewarm water. So have good water. And then, first thing is we need to pray to the nature, meditate, whatever. Be thankful for waking up. And then do some vyayama, then danta davana, which is very important. All the there are certain prescription. There's a prescription in Ayurveda to do the danta davana as well, and which is brushing your teeth. And then please make sure that your tongue is cleaned very well, because tongue once we examine the tongue, we will know the health of a person. So that is very, very important. I'll mention that an improper oral hygiene in a pregnant woman can lead to abortion as well. So it can be that serious. So it is imperative that oral health is that very important. And after that, abhyanga. So once this is done, abhyangam. Abhyangam is nothing but which is not possible always these days, but make sure we have that done on a regular basis to maintain good health. Abhyangam is nothing but you massage your body with oil. You can do it by yourselves, and then use oils. And if you don't find anything according to your prakriti, then least you can follow is take sesame oil, and then you can do it. The reason why we say this, when you do the abhyanga, the metabolism gets set. Skin being the largest organ, then there are nerve endings. It nourishes the nerve endings in the entire body, and that will only lead to activeness, and then good metabolism. So after that, then the bath, and then you can have a quick breakfast by 8:30, and then the next lunchtime would be at 12:30. So this is the morning schedule one has to follow, and sleep before 10 p.m. in the night. The reason why we say this is 10 p.m. onwards, once that is the time when pitta is very predominant, and that is a time when the body repair starts happening. So when we are used to working late in the night, or when we postpone sleep in the night, when we sleep very late, that is only going to impact our digestive health. So and that's the reason why you wake up stressful in the morning, unfresh in the morning. Because during the time when the body starts repairing itself, if you are awake, the mind is pretty active, and that will only lead to aggravation of pitta, right? Next thing is Rutucharya seasonal regimen has to be followed um, according to all the ritus. Then Kaya Kalpa Chikitsa, rejuvenation therapy, can be followed. As I just mentioned about the Abhyangam and all of those, there are other treatments as well. So in this Vasant Rutu, I'm just telling you that there's a Vamana therapy that is being done, which is one of the Panchakarmas, and that is done for to maintain the health of the people. So that can also be done, but just these are small practices that you can develop on a daily basis to keep your gut health um, well. So, so once this gut health is being maintained, the tissues in the body are nourished very well, and that's how your metabolism gets set, and that will lead to overall immunity, which we call as ojas. Ojas, again, there are two types of ojas, and the dhatus are nourished really well, and that will only prevent autoimmune issues in the long run, and your health will be very well. With Vyayama and all of that, you can postpone arthritis. But there are a lot of cases where, there are joint aches and body aches. People come to us with body aches, and especially the spine cases. So these are very prevalent, and as we all observe, cancer cases are also increasing. So these are certain things that we need to follow to maintain very good health, and then improve our immunity. Otherwise, any kind of stress that you go through, chronic stress, please try to reduce that. That happens through meditation, or the breathing exercise. There are You can go to your yoga practitioners and learn yoga, and then do that any 2 or 3 asanas every day with some breathing exercise, pranayam, nadi shodhana. So these things, when practice, it will hardly take 15-20 minutes. Or if you can allocate half an hour for yourselves in the morning, definitely you will be postponing lot of issues, or you will be avoiding lot of issues importantly. So these are the kind of steps that you will need to take. Otherwise, we also observe that once you have a lot of stress at a particular period of time, so you will see that you will catch cold frequently. So people under um, constant stress, they experience recurrent cold. So, and again, cough is also observed in people with lot of stress. You can catch cold and cough very frequently. So when you do that, just make sure, just you can understand that your immunity is on a lower side, and then you need to improve your immunity. That's what you need to check for yourselves. To some superfoods that you can consume on a daily basis, like, amla and then turmeric. So these are things that we generally use, but there are a lot of other foods, especially please consume calcium rich food, like, you have methi and greens. All of these have to be part of your daily, diet regimen. And then green leafy vegetables. If you're non-vegetarians, make sure you don't eat a lot of spicy stuff, and you don't eat it regularly. And all of these things have to be followed. And there are some foods, as there's a topic called naimittika rasayanam. So that word is very important in Ayurveda, and for every ailment, there is a drug being prescribed in Ayurveda. So that can be taken along with your medications in case you're on certain medications. But then to avoid all of that, this is a strong recommendation that these practices have to be, adopted right from childhood for yourself and for your kids as well. That's it from my side. I hope I'm on time.
Yes, ma'am. Thank you so much, ma'am, for that super elaborate presentation. Uh, Thank you so much for your patience as well.
Yeah.
Before we move on to the Q&A, I'd like to just take 30 seconds of everyone's time. This will help us get to know you better and tailor future topics that we bring to you. A big thanks to everyone here today. Your presence and participation means a lot to us. While you fill out the poll, I would also like to extend my heartfelt thanks to our esteemed speaker, Dr. Srijana Komitreddy, for sharing her valuable time and insights with us. I request all of the
Thank you.
participants to quickly interact with the poll so that we can move on to the Q&A. If you have any questions, you can use the raise hand tool uh, by pressing the react button at the bottom of your Zoom interface. And I will unmute you. I will prompt you to unmute yourself. Also, you can write down your questions in the chat box.
I can see.
Yes, ma'am. We'll just get done with the poll and then we'll start with the Q&A.
Sure.
I request all of the participants to quickly interact with the poll so that we can close it fast and move on to the Q&A. Also, before we move on to the Q&A, I'd like to quickly mention the upcoming talk. We have Viresh Valli, an agricultural economist and millet value chain expert. The topic he's speaking on is the future of food, know why millets matter more than ever. This is on 1st August 2026, 11 a.m. onwards. I request you to register for this particular talk by using the registration link in the chat box. You can also share the registration link with your friends and family. Okay, I'm just going to end the poll right there.
Thank you.
Okay. Moving on to the first question, I'd like to first unmute Mr. Shmuel. Kindly unmute yourself.
Thank you very much. You hear me?
Yes, sir.
Okay. I want to ask a question. How Ayurveda approach can support improvement mental health? How Ayurveda approach can support healing mental disorders?
Uh, to re-elaborate the question for the rest of the participants, Sir is asking how Ayurveda can support mental health and healing of mental disorders.
Yes, sir. Thank you, sir, for this question. So, mental health is, as I mentioned, the definition itself mentions that the overall health is physical, mental, and the social well-being of a person is considered health. And in Ayurveda, we have a separate branch called Manasa Roga, which is Graha Chikitsa is what we mentioned. So, all of these mental health issues are dealt with. By the practitioners, and definitely there are solutions for mental well-being and mental health as well, right from doing the do's and don'ts, and also there are medications and panchakarma therapies that can be prescribed to the patients.
Thank you very
So it
much.
depends on the condition. So the Manasa Roga Chikitsa is a subject in detail, and there are Manasa Roga practitioners as well. So that's a separate branch. It's a specialty that people pursue and then practice. So as Ayurveda doctors, we do take up those cases, and we definitely treat those cases.
Thank you very much.
Thank you, sir.
Thank you for joining us, sir. Ma'am, I wanted to ask a question from my end. So,
Yes.
I have experienced lately, like around me, some people having this thing called tinnitus. I had
Yes.
it for some time too. So a constant buzzing. How is it placed? I really don't know whether it's placed in a mental disorder, like because some people have it due to stress, and then there's also reasons like cold because of which you have it. Constant cold, and when your sinuses everything gets blocked, you can get that. So, according to Ayurveda, how is tinnitus approached, or what is how is
Yeah.
how is it looked at?
Yes, tinnitus can develop due to various factors, Trishant. So, here you say that you're experiencing a recurrent cold as well, right? And when there is congestion, you develop that. And also, tinnitus can develop due to cervical spondylosis as well. So when there are spine issues, also tinnitus can develop, and there are some blockage, and then where there's some infection and all of that, it can develop. So you often see this complaint in people with kapha disorders as well as in vata kapha disorders, wherein when the spine issues are there, definitely in a long run, when it becomes chronic, then people are bound to develop tinnitus. That needs to be addressed quickly. Yes. Hope I answered your question. And definitely there are
Yes, ma'am. Thank
solutions
you.
for tinnitus in Ayurveda. Yes. And it is treated on a case by case basis.
Uh, yeah, every person has a different, unique,
Yes.
right?
Yes.
Uh, I'm just going to unmute our second participant. Sir, I kindly request you to unmute yourself, Mr. B.S. Nagaria. You're on mute, sir. I've
You're
just
on mute.
prompted you to unmute. So kindly unmute yourself. I've prompted you to unmute. You will see a dialog box requesting you to unmute. Uh, so I request you to kindly write down your question in the chat box so that we can answer it. Ma'am, I'm going to read out the questions from the chat box. Uh,
Yes.
Mr. Chandresh Roth has asked if consuming sea buckthorn is okay.
Yeah, it is good for health. It can be consumed, but in limits. Just don't overuse it, or just consult your Ayurveda Vaidya in case required, but it is taken as a nutritional supplement these days.
Right. Thank you. Uh, okay. There's a participant asking, could you please suggest yogasanas or pranayamas for mental health?
Mental health, yes, definitely. We have Nadi Shodhana that needs to be practiced, and Kapalbhati is there, and Brahmari, if you do, there's a lot of research happening. And when you chant Om also, that literally has a lot of effect on your abdomen as well as your mental clarity. So once you do that, and Brahmari is one thing that one can practice, and Nadi Shodhana as well. And I would suggest that one gets trained under a yoga teacher and then practice that. You can learn that very easily and then practice that on a day-to-day basis. And that needs to be done by people of all ages.
Thank you, ma'am. Uh, could you, okay, there's a question from Mr. Manish T. Mehta. Do you have any suggestions for viral arthritis recovery? All tests are negative.
Yeah, sometimes, the lab tests, we come across a lot of uh, patients with the lab test being normal or the negative, this thing, it's again, we need to examine the patient and offer the solution. But yes, definitely we will have either it is management of the case or uh, whether that needs any surgical intervention, be it any kind of arthritis, yes. And again, it depends on Rogi and Rogabala. That is very important.
Uh, there's a question from Ms. Shanti. Hi, ma'am. I have histamine intolerance problem. All the time I have cold and blocked nose. Can you please explain on that? Is it
Sorry, what
related
was
to
the first part of the statement you mentioned?
uh, I have histamine intolerance problem.
Okay.
All the time I have cold and blocked nose.
Yeah, so that you will need to consult your Vaidya, not just this complaint, but we'll need to take history and then treat. But there are a lot of supplements that you can take. There's Chyawanprash available. Make sure you take very authentically prepared Chyawanprash, or for to build immunity and for recurrent cold. We offer a lot of medications that can be consumed as supplements. So there are simple formula, but they give really good solutions, and good they are good in alleviating those issues, whether it is recurrent cold or cough, or there's a lot of congestion that people experience a lot of times. But from your point of view, one needs to be taken care of whatever I have mentioned earlier. So the don'ts have to be practiced very strictly. Like, you can't have water from the fridge and then not complain about having headache and all of that. So those are some of the things that we will need to follow. But for that complaint, you will need to consult Ayurveda Vaidya,
Thank you,
because
ma'am.
I see a lot of questions coming up. But here, one mentioned about chronic pancreatitis and then lactose intolerance. These are some of the things, right? So these all need examination, case history, and then medications can be provided. But overall, at a higher level, I would mention that Ayurveda is meant to treat the root of the disease along with the symptoms. So, for that, we will need to assess the patient and then provide medication. For
Right.
emergencies, definitely allopathy and Ayurveda should go hand in hand, uh, and then for management of all the cases, Ayurveda helps a lot. There are different
Right.
medications that can be prescribed.
Thank you, ma'am. Ma'am, I'd like to ask a question
Mhm.
from my end. So nowadays, there's a lot of social media usage, a lot of Instagram usage, TikTok usage, which uh, studies reveal sort of affects your attention span and focus. So your attention span reduces to whatever trend is going on right now. It's like 7 seconds and lesser than that sometimes. So are there any plants? Are there any uh, herbs that help in? Like I know of one which is Brahmi, something that I have in my
Yummy.
garden,
Mm-hmm.
Brahmi. So are there any? Uh, could you suggest anything else which is similar to that and could be grown in our backyards and could come really handy for
Yeah,
focus,
Brahmi helps, and to increase the focus or attention, I would say screen time should be lessened first.
reduce?
So, children with online classes, there is no choice but for them to attend. But other than that, how much it is required, it is better to use it. Otherwise, just try to reduce usage of the screens as much as possible, and continuous screen time, be it on TV, be it on laptops or phones and all of that, that is a serious problem, and it has already become a health hazard. So, Brahmi, yes, supplements are there, Trishant, and there are few other supplements also that one can take. Like, Amla, for example, that can be taken. Brahmi can be consumed. There are a lot of formulae in the market that you find to improve your immunity. But for brain fogging or mental clarity and all of that, first thing is reduce these, have good food, and good sleep is very, very important. So once that is followed, right, you will automatically see that there is a difference. So the AirPods that we use and continuously, so that will aggravate vata. If you see, the hearing problem comes because there's constant pressure on the eardrum, so which increases vata, and then that's where the hearing impairment also starts. The focus gets diminished, and then that's where all these mental health issues also, at lack of attention, especially in children. So these are some of loud musics, and these are all not recommended.
Like you said, eye, ears, if there's a problem, is mostly related to Vata issues.
Yeah.
So with the eye also, is it similar? Like, I mean,
Yes, ice
is it
also it
Vata
is the
itself?
same. Yes, ice also it is the same. Coming to your question before, so there are a lot of Medhya rasayanas like Brahmi, Shankapushpi. These can be consumed, and seasonally whatever is recommended. I would suggest that all of you please reach out to your Ayurveda Vaidyas wherever you are, and then consume it. And there are a lot of supplements that can improve your immunity. And for eye health, definitely there is Akshitarpanam that can be done apart from Abhyangam. So that will only rejuvenate your eyes, as well as eating, a lot of carrots, raw mango. So all of these vegetables that are rich in vitamin A, those can be consumed. And one of my favorite supplement is Saptam Drotalohamu, so which is an Ayurvedic preparation, classical formulae. So that helps improving the eyesight as well. So these are some of the things that can be taken. I mentioned Rasayana, if you remember. So Rasayana Chikitsa is something that everybody needs to take at least for 2 to 3 months in a year. If you consume those supplements, that is easier. I'm not trying to say that you should take supplements on a regular basis. There are certain things that for each part of the body, certain drugs are being recommended, at least in the fast paced environment. Instead of popping up unnecessary pills, let us consume these things. Right, like the turmeric milk, and there's a formula called Haridra Kand, which is very helpful in allergies. So we see a lot of allergies also these days. So these are kind of things that one needs to take. And in what form? I would say, please grow these plants. But what is the part that you will use? That is that knowledge has to be there, and then you can use it. Like Punanava is grown everywhere, and that is really good for renal function. So consuming, but I would say Panchangam is being used in preparation of those tablets. But then, people consume leaves, right? So for few herbs, shrubs, and plants, the entire plant is being used. For few of them, it is only this one.
Just the
What
root,
few parts of the plants are being used.
just like the root or the bark powder or
Correct.
something.
Correct. So that knowledge has to be there. So I would say that reach out to your doctors and then take those supplements.
Ma'am, is there say, I mean, a lot of people have issues with regulating their emotions, like anger or sadness or too much of, I don't know, um, excessive energy or hyperactivity or something like that. So, is there a study or is there a vidya which is related to regulation of emotions? Uh, or, yeah, something that allows you to control your temper, be more calm, or maybe be less calm in certain cases? Uh,
Yes, stress management, anger management are some of serious issues one faces, right? So, as I mentioned, meditate definitely every day or regularly. And once you follow these, the Nadi Shodhana and Brahmari and all of those, right? So that'll enable us to overcome these kind of issues. So it's a very comprehensive tool that Ayurveda offers to lead our life happily.
Thank you, ma'am.
And yes, definitely, the sleep pattern, one needs to sleep, have sound sleep for a couple of hours, for 6 to 8 hours, 6 to 7 hours. So again, it depends on each individual. Few may need less number of hours to stay active, and few may need more hours. So just assess yourselves, how your health is, how your appetite is, and then so these many calories, this portion of food may not suit everybody. So even for mental health, so all of these stress management also comes under our psychological or mental health, right? So these are certain things we need to assess ourselves and then follow. This all comes under vihara, where we need to follow regular good sleep cycle. So that solves the problem half. And then daily meditation and all of that, breathing exercises and yoga will definitely help people overcome all of these issues.
Thank you, ma'am. Ma'am, there's a question from Miss Pinky. Could you please suggest me or please guide me about Hashimoto's? I'm not very well aware about the term. Hashimoto's. My anti-TPO is 600. I want to cure and heal inflammation myself.
Yeah, so I would recommend that please reach out to the Ayurveda doctor, and
Practitioner.
this needs to be examined thoroughly before any prescription is being given. Yeah, so there are some do's and don'ts. So not maybe if I recommend something here, that may not suit her, right? So these are certain things that needs a detailed consultation. Wherever you are, reach out to your Vaidya, and then take medications accordingly. And if you have to treat yourselves, yes, definitely these are certain things. Apart from medications, you will need to follow whatever I have mentioned. You can take guidance from your doctor and then start doing it yourselves. That much I can tell you.
Thank you, ma'am. Ma'am, there's a question from participant. How to help constipation and bloating for an 80-year-old male who needs to spend 6 hours in a day to relieve and almost goes 7 to 8 times to relieve himself.
Sorry, your voice was breaking, Trishant. Who needs to spend 6 to 8 hours?
Uh, how to help constipation and bloating for an 80-year-old male who needs to spend 6 hours in a day to relieve and goes almost 7 to 8 times to relieve himself,
Okay,
right?
so I would say that simple formulae which is available everywhere. There are other medications also, but I would say that consume Triphala. So that might help, or there are some other combinations also, which will help relieve. Obviously, owing to age, these are age-related issues, and then you will need some help with medications. And Triphala is one of the best thing that you can consume. Up to 1 gram. Start off with having it in the night, and then if you don't find relief, then you can have it twice a day. And there's another medication, super medication, which is Avipattikar Churna. It is a very mrudu virechankari, and then you can have that on it safely. You can have it. Triphala also you can
Thank you,
consume
ma'am.
safely.
Thank you again, ma'am. Can Parkinson's be cured? There's a question from the participant.
Managing Parkinson's is, we can do that, but it all depends on at what stage it is and how serious the problem is. At the starting stage, we can obviously support. We have a lot of medications and panchakarma therapies to reduce the episodes of dyskinesias and all of those, right? So, Kampavata is manageable according to Ayurveda, but one needs to take medications under supervision. You need to go to the doctor as you go to an allopath doctor, and it happens over a period of time. It can be managed. Um, uh, I won't promise, but again, as I said earlier, it is again Rogi and Rogabala. It depends on that. At least we can stop the progression or slow the progression of the disease.
Thank you, ma'am. Now, on this question from Mr. B.S. Lonagaria. I am suffering from my lower back uh, pain and also at both the knees and thighs due to post-herpetic neuralgia since last 40 months and almost on bed rest. My age is, my weight is 70 kgs and my height is 5 feet 8 inches. I have referred 3 Ayurvedic doctors, but they can't give any relief. Could you please guide me on a video call or WhatsApp?
I can certainly guide them, definitely. But then, what is the age of the patient? So you,
So could you please write your age in the
uh-huh.
chat box?
So I would say that you already mentioned that you have been to 3 Ayurveda Vaidyas. So there are Panchakarma treatments that one needs to follow. And then take, and it can get relieved in 3 weeks, 2 weeks. Again, it depends on what is the severity of the issue, and followed by management of the case with medications. So we
Sir is
perform
70
internal
years old.
vasties, 70 years old. I see that, yeah. So in some internal medications can be taken as well as some bahya vastis like kati vasti and internal vasti like matra vasti, and there are some other treatment methodologies that we will need to follow and treat the case until they have relief. So if you are from Hyderabad, I can recommend, or wherever you, or reach out to Panchakarma Center, and then wherever you are, and then get treated. But this needs attention, definitely.
Uh, And there's a question from Katyusha. How can we and where can we get to know one's Prakriti?
Prakriti is known by Nadi Pariksha. Ayurveda Vaidyas usually do the Nadi Pariksha before they go ahead with prescribing medications according to the ailment. So, any Ayurveda Vaidya who are dedicated, there are few people who do the Nadi Pariksha. Which place, if you can let me know, I can refer you there and then you can go get it checked. But usually, all the Ayurveda Vaidyas they do Nadi Pariksha. You can reach out to your Ayurvedic doctor close by.
Okay.
It's a big
Um,
science again. Yeah.
thank you. There's a question from Shanti again. My IgE levels are 800. I have more allergies. How to overcome this?
Allergies, again, that means your immunity levels are need some attention to, and then you will need to be on certain medications and how are your habits and all of these. This needs a proper examination. And then I would recommend that you can start using supplements like Chyawanprash and then have Amla and other nutritional supplements, Ayurvedic supplements that are there in the market. So, as per prescription from your doctor, and then you can see those levels coming up, and you'll have some relief. Definitely, it can be treated.
Thank you, ma'am. Another question for Pratyusha. What is the best morning or night herbal drink according to Ayurveda recommended for a happy gut?
What is a morning and night? Sorry,
Morning or night herbal drink
herbal
according
drink.
to Ayurveda recommended for a happy gut.
Happy gut. So my favorite drug is Yashtimadu, Glycyrrhiza glabra. So there are several herbal teas in the market. So you can have either tulsi tea or there's jeera we all use at home, right? So cumin seeds. And there is ajamoda, which is carom seeds. So these are all certain drugs that are really helpful for the gut to reduce vata and to uh, balance the pitta dosha as well. So you can have any of these. And mulethi chai is something, mulethi tea is what you can have, or tulsi tea. And those are certain things. But whatever suits you, please do have. But not on a, we can't overdo everything. So everything in limit is good. Ati sarvatra varjayet.
And so, is there a possibility that you can develop tolerance towards a certain medicine or combination of herbs? Like it stops working on you after certain days of usage.
Mm-hmm.
Is it possible that you develop a tolerance towards certain things? Like maybe if you consume tulsi every day in minute quantities, there is a point of time after which it stops working on your body.
No, it is
If
not
you
like
maybe
that.
overdo it or something like that.
It is not like that, but I would
Okay,
say do it in limits and whenever it is required. Why do we want
required.
to overdo, right? Tulsi, if you
Yes,
have it in more quantity. So again, when we talk about gugulu or tulsi, tulsi is something that is being used by yogis, right?
right.
So tulsi can't be consumed in lot of quantities
Quantities, definitely.
regularly. So there's a reason for it. So yeah. So one or two
Thank you.
leaves, which is fine, is fine.
Ma'am, earlier, B.S. Donagaria sir had mentioned about the lower back pain and it's due to post-herpetic neuralgia. He's
Sorry,
mentioned that even
Prashant, I'm not sure if my internet connection is there's a problem. But am I audible clearly?
yes, yes, absolutely.
Okay, okay. Maybe I'm having struggling to listen, so I'm just wondering if my
It
internet
could
connection
be
is
my network issue also. That's why
okay.
maybe. Ma'am, so earlier, Mr. B.S. Lunagaria was mentioning about his back pain due to
Mm-hmm.
uh, post-herpetic neuralgia. He's from Gandhinagar. So would you happen to know any? You could suggest anybody who could look into his issues or something like that.
Yeah,
I can definitely
I can
share
talk.
your contact. Sure.
Yes, okay. Or else, if there's anybody in Gandhinagar, I'll find out. I am not sure of doctors there, but then I can talk to him, talk to Sarah. Yeah, I can
Ma'am,
do
if
that.
I may have your permission, I, I can share your official or some email address
I'll
to
yeah,
which
I'll send my clinic number to you or Pratyusha
Pratyusha,
later, and then you can just give it to them.
and she
Yeah.
will send the link of this particular talk and also the uh, contact details to all the people who registered and also the people who participated,
Sure.
so that
I'll
they
send it
can
to
reach out to
Pratyusha.
you.
Yeah.
Sure. Uh, with that, ma'am, we've covered all of the questions in the chat box and also covered most of the questions here. Okay, there's another question
Fatty
from
liver.
Miss Anu. Fatty liver.
Fatty liver is a very common problem. So, what we eat, every other person is experiencing. Again, this is becoming more prevalent these days. We do have medications for fatty liver, but then we would want to know if you're on steroids or or on ecosprin. So these are certain statins also might cause so. And your eating habits have to be assessed, and then only we can prescribe medications. But that needs to be addressed because fatty liver in a long run might lead to diabetes and several other issues, digestion issues, and all of those, right? So that needs to be addressed, definitely.
Thank
Yeah.
you so much, ma'am. Thank you for your patience and thank you for spending so much time for us and answering all the questions patiently and giving us a wonderful presentation. It was a pleasure to have you with us on Vishwa Talks. And for anybody who's missed any part of this particular session and would also like to share the session with friends and family, I'm pasting the link of this particular talk in the chat box. You can save it and you can also share it with everyone. Ma'am, I would like to request you to join a